Okay, welcome community, and today what I'm going to go over is another mold case. If you're seeing this on YouTube or Facebook, could you do me a favor, click the link and maybe share it. Or if you're seeing it on YouTube, there's a couple links below. Subscribe to my station, you'll be notified of more content, or give me a thumbs up, because to be honest with you, when you hit the little button thumbs up, that actually helps these videos come up on searches of Floxed and full recovery. So today what I want to go over is a mold case. Like, here's the thing, like, I never used to check patients for mold, and then I missed some cases of mold, and I had no idea that they were basically full of mold. So I want to show you one of my patients that just came back today that is hugely full of mold. Now, when it comes to mold, you want to test and not guess. This is the key thing. You want to test and not guess, especially when it comes to mold. Either you have mold or you don't have mold. And when it comes to the testing is very critical, because it will really tell us, like, is this a past exposure, or is this a current heavy exposure? So this is one of my patients right here. I want to show you her testing. Now, this is fresh off the presses. This is the myotox test. So you can see right here the myotox test. And you want to come down here, and we're talking about aspergillus mold, and then right here the gliotoxin. So the gliotoxin. So this is a very poisonous. It's a very poisonous mycotoxin. And what I want you to do is look at the levels here. Look at her levels. Her levels are 41,221. All right, that's her levels. And then this should be less than how much? 200. So here we have a person that's been flaxed, that's been damaged, and her levels is 41,000 and normal is 200. And she would have had no idea that she had mold exposure. Now, when she came to me, she has a bunch of depolarization, anxiety, panic attacks, fibromyalgia, GI symptoms. What I find clinically out there is when people have an array of these symptoms and they're all over the map, we have to rule out mold, right? You have to rule out mold, because the myotoxins, it's not like you can go in and kill mold. Mold's not like, it's not like a bacteria. The mycotoxins are spores, and these spores leach into your gut, right? If they're in your gut, they're in your gut. Then they go in your bloodstream, and when they're in their bloodstream, then this causes inflammation in your bloodstream, and then inflammation in your brain, and then you have all these weird neurological symptoms. So when it comes to the power of this test, this mycotoxin test, it's a urine sample. So what's happening is we take a first morning void of your urine, and what we're actually checking for is to see if there's actually mycotoxins or spore forming chemicals in that urine. So what you have to kind of like wrap your head around is, where did that urine come from? That urine came from your blood. So what we're actually trying to do is, in the urine, the concentration of the mycotoxins are anywhere between 100 and 1,000 times more concentrated in your urine than in your blood. So if it's in your urine, guess what? It's in your blood. If it's in your blood, it's everywhere in your entire body. That's why people can have all these strange and weird neurological problems. And now from there, where is it coming from? Now is it probably sitting in your gut. So what do you do for this? A case like this, you got to start to pull out the mold. You got to start using binders. You got to start using very specific supplements and protocols to get the mold out of there, so the body can start to recover. Then also you have to figure out where the mold is coming from. Where's the leak? Where's it in the house? So it's a two-pronged approach. But at the end of the day, what we're trying to do here with the functional medicine is we're trying to increase your body's ability to heal and function. And when you do that, you can recover. You can get better. Not everybody has problems with mold, right? So it's a select few people that if you can get your body functioning optimally, that you can actually recover and get better. So at the end of the day, where there's help, there's hope. I hope you found value in this. And if there's one test that needs to be done, is it needs to be the mycotox test, the urine test. So if you have any questions, down below in this video, there's going to be a bunch of different links to my videos, to my Facebook page. I give a free eFlox course away that's valuable for you. It's free. Just click the link below and get that. So take care, and bye-bye.